Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Homeopathic remedies for constipation. Constipation is one of the most common diseases of gastrointestinal tract. Everyone suffers from this disease sometime or other during lifetime. What are causes of constipation? 1. Weak peristalsis. 2. Want of physical labor. 3. Want of enough fiber in food. 4. Want of water. 5. Change of daily routine. 6. Mental stress and strain. 7. Continuous suppression of urge. 8. Due to bile disorder. 9. Due to change in system. 10. Following big surgery. 11. Too much use of purgative. 12. IBS or other irritable bowel syndrome. 13. Anticonvulsant, antidepressant, diabetic, iron supplement, antacid, etc. Common disease medicines, modern medicines. 14. Food drinks with mycotoxins. Actually, almost every food, whether it is ready-made or cooked, contains some sort of mycotoxins, and this mycotoxin also, if it presents in higher amount, it can cause constipation. Now, video. It is other constipation, peristalsis action. The action of peristalsis is shown here. How to prevent constipation? Number 1, drink water at least 2 liters a day. 2, take fresh veggies, fruits daily. 3, never suppress urge of stool. Number 4, never practice taking laxative daily and consult your doctor while taking any modern allopathic medicine for a long time for its side effect. Probably engage yourself in physical PT, actually physical exercises for at least 20 to 25 minutes daily. Get breakfast, lunch, afternoon refreshment, dinner timely. Timely taking of food is very important. 7, avoid taking ready-made tin can foods, drinks regularly. Do not take this type of food regularly. Often you can take it. Avoid mental stress and strain. Now, medicines. Calcarea carb for constipation. Profuse sweat at back of the scalp. Sweat and stool smell sour. Note this: sweat and stool smell sour. This is a characteristic symptom of calcarea carb. It is a general symptom. It is present in almost always if the patient is calcarea carb. Subjects are fat, flabby generally, not in all cases. Old persistent constipation, stool hard like chalk or light color. Feet are wet and cold. Particularly a part of body seems cold. Feet wet and cold is a characteristic symptom of calcarea carb patients. These are general symptoms. General symptoms are most important. That's such as sweat, stools smell sour. This symptom: sweat and smell sour, feet wet, cold. These are general symptoms. General symptoms are much more important than particular symptoms. So, if you match these particular symptoms with the patient suffering from constipation, then it will act nicely, and probably that will be his medicine. So, whenever select a medicine, please go for not specific or particular symptoms, also go for the general symptoms of the patient, maybe mental, maybe physical, general. This is actually a typical calcarea carb patient. Lycopodium clavatum for constipation. Rectum full of stool, yet no urge for days after days. Stool hard, scanty, incomplete. Spasms in anus obstruct clearance of stool. All patients with lycopodium always barf. Abdomen full of gas. Loosen clothes around waist. They like sweets. One drinks. All problems tend to aggravate from 4 to 8 p.m. These are general symptoms. They like to keep mum, to stay alone, but somebody must be in next room. They are intellectually keen, but physically weak. Upper part of body emaciated and lower parts semi-dropsical. From this to this, actually, from not only from this to this also, this lycopodium patient always bar, abdomen full of gas. They are all general symptoms. If it match If these matches, I mean these symptoms match with the that patient, that it will surely act. Sulfur for constipation, evacuation always seems unfinished. This is also noticed in Nux vomica. Stool as if burnt, severely dry after stool, pain in anus hours after hours. The pass stool every 3-4 days after with extreme hardship. 3-4 days after extreme hardship. Sometimes hard stool so large that it becomes difficult to evacuate due to pain. Patient of sulfur feels too hungry at 11 am, cannot tolerate heat, cannot keep clothes on, like to take sweets and fatty foods. Palms and feet hot, lips ear red, all excretion acrid, scald skin when touched. This is a must for every scrofula child. The person, if he has got scrofula diathesis by birth, then sulfur is a must for him or her. This is a typical sulfur baby. Note, he is in bare bodied because they feel good while in bare bodied. Next one called constipation. Stool very scanty. After evacuation sensation as if much stool remains within. Incomplete evacuation. False rush to evacuation. After eating sensation as if pins and needles in the rectum. Especially after doing study or something very attentively. After stool, anus as if contracted, as if tied with something. Fresh blood with stool. Subjects of NACs are very particular. General symptoms, these are all general symptoms. Subject of NACs are very particular, tenacious, careful, but inclined to become easily excited, angry. Main reason for constipation or colic of NACs is irregular peristalsis, spasmodic contraction, which pushes and pulls, simultaneously push and pull the contents of intestine at the same time. These are very troublesome. One is giving push, another giving pull. That's why there is a problem. Brownie alba for constipation. Chronic constipation with severe headache, no urge for stool. After a lot of exertion with increase of blood flow to the head, scanty stool which is dry, blackish, solid as if burned. Solid as if burned, this symptom is available in sulfur also. Sometimes huge, long, hard stool. This is also present in sulfur. Solidified stool creates obstruction. Abdomen gets distended. There is much rumbling, gargling. Yet, inveterate constipation. After stool, burning in anus for a long time. Tongue white coated with intense thrust. Worse from any motion or better and better from absolute rest. Patients irritable, inclined to get angry, nervous. Let's have mule for constipation. Inveterate constipation. Stool hard, dry, difficult, crumbling. Sometimes involuntary, knows not whether fetus or stool would escape. This symptom is seen in aloe, muriatic acid, iodium, muriatic acid. It is written twice. Sensation of contraction in the anus, tearing, bleeding, smarting afterwards. Tongue mapped with red patches. Like ringworm on sides, these symptoms are in arsenic, lactaceous, mercurius, and nitric acid. Patients irritable, lacrimose, don't like fuzz or consolation, craves, and very much averse to salt, or either craves or very much averse to salt. Both. You may want salt more, or you may completely dislike it. Dislike of fat and bread. They are introvert, perfectionist, loyal, dedicated, but guided emotionally. Very much sensitive to criticism, rudeness, and humiliation. Mind this, these are every symptom is general symptom. If it matches, the medicine will act nicely on them. These symptoms in introvert, perfectionist, loyal, dedicated, guided emotionally, but very much sensitive to criticism, rudeness, humiliation. These have nothing to do with constipation. This is represent the patient. So if patients suffering from any disease have got this type of personality, This type of mental general symptoms, then he is a patient of constipation, he is a patient of natamur, give him natamur, every disease will be cured. This is homeopathy. Mind this is homeopathy. Homeopathy doesn't match the clinical symptom, it matches the person, the individual characteristic, individualization of the patient. These are the individualizing features of natamur. Mind it. Please remember this. Lack the floor for constipation, weak, dry, painful evacuation, severe headache with inverted constipation, very much chilly with constipation, cannot warm up body after a lot of exertion. Patients very much sensitive to cold weather, cannot tolerate cool air draft. Worse from touching cold water by hands, from drinking milk, averse to milk. There are also general symptoms, please note. Platinum made for constipation, difficult evacuation, stool adheres to anus like putty, often urged to pass stool comes but unable to exert pressure. This is also seen in alumina. Inverted constipation, ineffectual urge. Stool hard, very scanty, sometimes sticky with undigested foods. Think self superior, big to all. Others seem smaller, inferior to self. This is a very characteristic symptom of uh, platina. Mind it. The patient himself or herself looks that he is the most superior person in the world. All others are inferior to him. Very much arrogant, always belittle others, senses as if navel is tied to back with a rope. Plumber made for constipation, unbearable constipation, stool long, lean, dry and hard, evacuation very much troublesome, paralysis of intestine, unable to exert pressure during alumina, during stool, it's present in alumina also. Bleeding from intestine, sensation as if abdomen is tied to spine with a rope. Plumber made patients are thin, paralytic, lie on bed weirdly. Alumina for constipation. Inability to rectum and urinary bladder. Great pressure required to evacuate even soft stool. Pressure also required to urinate. A lot of stool and rectum but no desire. Neither ability to pass it. Rectum as if paralyzed. Stool hard, knotty, covered with mucus or soft like clay adhering to anus. This symptom is also there in platina. Patients don't like to take meat, can neither bear the with potato. Think time hangs heavily on them. Feel an hour as half a day. Desire to commit suicide on sight of knife or blood. These are very interesting symptoms, and if it matches, alumina works nicely on them. Problem as above often seen in person used to cook foods in aluminium utensils. Mind it, this is some sort of aluminium poisoning. Noted that it is noted that they disappear. They means the symptoms disappeared when utensils changed. So if you have got this type of patient, please you may ask him whether he or she takes food from a pot of aluminium used in used during cooking. If the cooking utensils are aluminium and the patient suffers from this type of symptom, then you just ask him to change the utensil. This symptom will automatically go. No medicine will be required. Conium MAC for constipation. Sensation as if rectum paralyzed, ineffective urges. While passing stool required pressure so heavy that cause of prolapse of uterus. That is the pressure causes prolapse of uterus for women of course. Severe lassitude, palpitations after attempt to evacuate. Profuse sweat just on sleeping. Dreads being alone, yet avoids company. Breast of conium ladies sore, hard, painful during and after menses. This is a general symptom. This is her general symptom. This is not related to constipation. Causticum for constipation. Repeated ineffectual urges, severe pain, red face from anxiety. Rectum inactive, full of hard stool, which often comes out involuntarily. This is also available in aluminium sucotrina. Hard stool, as if covered with grease, feels easy to pass stool while standing. Piles swollen, itches with stitching, pain, obstructing evacuation. Problems increase during walking or while thinking of ailments. Intense sympathy for others' sufferings. Cannot tolerate injustice, cruelty to animal. Goes furious. The last few symptoms relates to the person in general. So these are very important for matching the medicine with the patient. Whatever may be the name of the disease, doesn't matter. CPR for constipation. Ineffectual urging, no urge for days after days. Constipation during pregnancy. Sensation as if there was a ball or weight in rectum, which not gone after stool. Stool hard, knotty, in balls, insufficient, difficult. Pain rectum during long after stool. This is also seen in nitric acid and sulfur. Prolapses of the rectum. For heavy pressure during evacuation, patient perspire severely. They are indifferent, no care for dears and near ones. They are disposed to get affected with prolapse of internal organs like intestine, rectum, uterus. See, this various prolapse on the abdominal walls, also in groins area. These are prolapses. All are prolapses. CPR patients are very disposed to get prolapses of internal organs. Mesarium for constipation, stool as hard as stone, like black balls, sensation as if rectum would burst out. During evacuation, prolapse of rectum or constipation or contraction, difficulty to reposition rectum after prolapse. That is, after prolapse, generally rectum again goes back to its old position, and this sometimes this becomes very much difficult. That difficulty to reposition of rectum after repulse, after prolapse, is tackled by Mesarium confidently. Passing huge quantity of foul flatus before stool, sensation of fear arising from stomach area. Shanicula for constipation, no urge unless huge quantity of stool accumulates in rectum. Stool grayish white like balls. Evacuation almost impossible. Stool partly expels, then recedes again. This symptom is available in Thuja and Silesia also. Even after bath, odor of stool comes from the body. It is seen in sulfur. Children of Sanicula look like old men, skin unclean, oily, head sweats profusely at night. Please note this Sanicula baby. General procedure for application of remedy in acute disease. Taking 4 globules of 30 potency as a single dose, give 4 doses every 3 hours in a day for 3 to 4 days. If no result achieved, give 200 potency 1 dose after every 3 to 4 days for 3 times. Wait and watch. If nothing happens or situation worsen, consult senior physician. With this, the video ends. If face any problem, please write down in the comment section. I will certainly respond. Thanks for listening and viewing.